All right, everybody. It is now 2 minutes after 12. I'm going to just go ahead and get this kicked off here. Welcome, everyone, to the CTI Performance Year Application and Care Transformation Profiler Reporting. Go ahead and get started. So I wanted to take a moment to introduce myself. I am Kim Dixon. I am the new program manager for the CTI program. I'm looking forward to working with all of you and supporting your efforts in this program. I wanted to give you or share a quick update that Jessica Heslop has transitioned to a new role within CRIS, and so she's no longer managing the CTI program. So in order to keep things running smoothly, please send any questions or concerns that you may have to the care.redesign@crisphealth.org inbox. This inbox is covered by myself and Crystal Fort, who check this several times a day. And it's important not to email Jessica directly as she's busy settling into her new role, and any messages that may get sent to her may get a delay in getting to us and getting answered. So just giving you that little bit of information. Thanks so much. And I'm really looking forward to working with everyone. Let's go ahead and walk through the CTI resources that we currently have. So we have a CTI learning system. It's a comprehensive hub for guides, policies, and technical walkthroughs. There is a link provided here on the slide deck, and this link can walk you through all of the CTI resources that we have. We do have a policy guide covering the program structures and key components. There will be an updated CTI specification and methodologies document, which breaks down the implementation details. And then finally, the technical review, helping you walk through CTI episode constructions from claims to reconciliation. So any of these updated documents that will be published to the learning system on no later than this Friday, the 21st. And again, any questions, please do not hesitate to reach out. Email us at care.redesign@crisphealth.org. We have a new learning collaborative that we're excited to introduce. This is a space for hospitals to share successes, challenges, and strategies. This is a peer-driven environment where hospitals will lead the conversation and will focus on best practice sharing and/or problem solving. So we, CRIS, will host and facilitate these collaboratives, but we will not be driving the conversations or providing lectures. We can start by identifying top challenges, maybe what's working well at your particular organization. So we're hoping for good engagement. The first collaborative session we're going to kick off on Friday, May 2nd, and I have provided the link for that right here in the slide deck. So please join us, register for the Learning Collaborative, and join us to help make this program function even better than it already does. All right, so let's dive into Performance Year 5 changes for the CTI submission. As a reminder, your performance year for CTI for Performance Year 5 starts July of 2025 and will end in June of 2026. The application window opens on Monday, March 31st and will close on May 30th. Hospitals can add, deactivate, and/or modify any CTIs during this window. If you want to continue an existing CTI without any changes, you do not need to resubmit anything. It will roll over by default. If you choose to deactivate a CTI, you can now do that in the application portal, which I will show you. Just remember, you cannot disenroll mid-performance year. And also keep in mind that you will still see results for deactivated CTIs through the PY4 reconciliation period, just so you understand that there will still be that overlap there. Okay, next slide. So the application process, all CTI applications will go through the care transformation profiler, each hospital can designate up to 3 submitters with access to the participation management feature. So if you're a new hospital that's joining, you will need to reach out to us at the care.redesign@crisphealth.org and let us know which 3 users will be your submitters for your particular hospital system. If you need to add or modify any of your users, again, just email us at the care.redesign@crisphealth.org. And the CTP also lets you calculate beneficiary numbers and estimate volumes for each CTI, and then view the final estimates of the MSR policy table. Okay, let's move along. Some important things to consider during your submission to keep in mind is that there are new baseline years. New CTIs must use either calendar year 2022 or 2023 or fiscal year 2023-2024, however you want to delineate that. The caveat to that is that any CTI that is currently existing, as long as you do not change anything inside of that CTI, it will continue at the original baseline that you created it. For example, if you have a CTI with a baseline of 2019, as long as you change nothing inside of that CTI, it will stay grandfathered in at the 2019 baseline. You also have an option or a choice to change the baseline for those CTIs as well. The chronic condition flag, using the CTI is using baseline calendar year 2022, 2023, or fiscal year 23-24. You will need to use the chronic condition flag version 30. All other baselines use the condition flag of version 27. APR and DRGs, UI5 requires version 39 APR DRGs to ensure all submissions reflect this version. All right, so what is changing for CTI? So again, there are no pre-pandemic baselines. The new CTIs will use 2022-2023 or the fiscal year 23-24 baselines. We already talked about the grandfathered CTIs. There is an offset change stop gain. So we are now aligning stop loss with the traditional MPA scaled growth adjustment. Currently, all hospitals are subject to a 2.5 stop loss. However, now we're looking at a tiered quintile system. And as you can see on this table here, if you're in the 3rd quintile, you're still at 2.5 stop loss, but going up or down will adjust your stop loss percentage. Again, if you have any questions regarding this, do not hesitate to reach out at our CRISP redesign email. Happy to answer any questions for you there. Now I'm going to turn this over to our HSCRC so they can talk through the policy changes that have been made for MSR. Krista?
Yep, great. Thanks, Kim. I'm Krista Spiker. I'm the Deputy Director for Payment Reform at HSCRC, and I'm going to speak to just a few of the policy changes related to the MSR. So folks are familiar with the MSR. This is a minimum savings rate. It's determined by the total episode volume of all CTIs in which a participant is active in either setting-specific CTIs and or community-triggered CTIs. We did an assessment of the hospital outpatient CTIs and came up with 2 potential changes to the MSR grouping. And we'll cover this a little bit more in the upcoming slides, but we're splitting the setting-specific CTIs into 2 groups and moving episodic primary care CTIs into community-triggered group. Next slide. So here you can see a graphic on the left-hand side that sort of shows the groupings, group 1, 2, and 3. The current groupings are, there's 2 groups. The first is the community-triggered, and the group 2 is the other CTIs. The new groupings are as follows. So group 1, as you'll notice in the chart, is the PAC touch, palliative care, care transitions. Group 2 is emergency care and HOPT or hospital outpatient. And group 3 is now panel primary care, episodic primary care, and geographic community care. The graphic on the left is a tiny bit confusing. The community triggered in this table includes, again, both panel primary care and geographic community care. So those are the new groupings. If folks have questions about those coefficients of variation, please let us know. And then there will also be an option to include death in certain thematic areas. So when you go into your CTI, there will be that option. And technical folks on the phone, correct me if I'm wrong. I think that's across all CTIs, if that's relevant.
Yes.
Yes, okay. Great. Okay, next slide. We're going to talk about the groupings in a little bit more detail. So this change here, the care setting CTI, this new group 1, this change makes it easier to meet the MSR. If you'll notice on the first line, originally it was 8977, and now with the new grouping, we're at 7100. So it is, again, easier to meet the MSR. So we anticipate that this is, a change that folks will appreciate, and this will make it easier again to meet that MSR. If we move to the next slide, the new group 2 is completely new. So no change from before, but a new grouping of those CTIs, and folks can take a look at that at their own pace and let us know if you have questions. And then the next slide is the new group 3, which is the community setting CTI. Again, includes the panel primary care, episodic primary care, and the geographic community care. And the sample size to achieve the MSR in the community setting CTI has increased roughly by 50%, which generally increases the MSR participants faced by 1 to 1.5 percentage points. And this is primarily because both episodic and geographic community care CTIs require much larger sample sizes in order to detect the impacts than they did previously. So, we believe this to be correct based on code review and assessment of the statistical properties of the new data relative to the old data. However, we do understand that this change is, folks may have questions about this and want to discuss further. We wanted to bring this to your attention. Really weedy questions on this, we'd like to bring to the total cost of care work group. We do have a couple of technical experts on the phone if there are questions on the line today, if there are questions. But this is a change that we anticipate folks might have questions on, but we believe it to be valid and accurate. And still, there's the option to combine all groups of CTIs and add them together and apply a common MSR across all of them. And again, the waterfall policy, all of that excess savings policy applies the same as before as well. So those are the main updates on the MSR. If folks have questions, you can either email the inbox, as Kim mentioned. We can have a discussion at the next total cost of care work group in depth, or we can, take questions at the end as well. So
wonderful.
With that, I'll hand it off to Kim.
Thank you, Krista. Okay, so now we're going to head into the actual demonstration. So let me stop sharing my screen for just a minute and log in. Give me just one moment while I log in. There we go. Okay. Okay, everyone can see my screen, I'm hoping. So when you log in, so I'm working out of the demo site right now, so anything that you see in here will really not have any PHI information. This may be similar to what you see when you log in under the CRS, into the CRS for you. You're going to want to select the Medicare population tab. And then you may have multiple options here, but you're going to want to select the Care Transformation Initiative tab here. And that brings us to our Care Transformation Profiler. The only thing we're going to focus on today is this Participation Management button here, or tab. And so once we have reached this tab, we want to make sure that it is reading program year 5, fiscal year 2026. It should automatically default to that, but just in case it doesn't, make sure that you open up the drop down and select this particular performance period. Moving forward, all the different buttons here. So to create the new CTI submission, this button is pretty self-explanatory. It will create your new CTI. This edit active CTI submission, this will edit any current active CTIs that you have at this moment. You would do so by, dropping this drop down, selecting whichever one it is, and then you would just hit the activate the CTI button and it'll bring you into whatever current CTI you are using at this moment. View my CTI submission. This is where you're going to find any CTIs that you have currently submitted. And then reviewing CTIs. Again, this will let you know what CTIs you already have. And the fun part about this one is now you can disenroll any current CTI that you have right here from the portal instead of having to email us. And you would do so simply by, let's say you wanted to select this particular CTI you did not want any longer. You would simply select the disenroll button. It asks you, are you sure you want to disenroll for the upcoming performance period? You say yes. And then it'll pull it off and it'll no longer be on your list of active CTIs for performance year 5. Okay. Let's say by an accident you thought, oh gosh, nope, I actually don't want to disenroll for that. Not a problem. As long as the portal is still open, all you have to do is hit enroll. It's going to ask you, are you sure you want to cancel your disenrollment request? And then you would simply just say yes, and it'll put it right back on for you. So it's fairly easy, fairly simple to sort of follow along. But again, if you have any issues or any questions, obviously you would reach out to us via the care.redesign email address. And then you can also create CTIs from your existing definitions. So this is actually great if you only want to change out maybe some NCIs, you want to keep all the same definitions, or maybe you want to update the baseline data. That's why you would use such a thing. And again, you would select the particular CTI, and then you would just hit the create CTI from here and move forward. Okay. Let's go ahead and create a CTI. Let's go through that process right now so that I can show you how everything works. When you select the create a new CTI, the very first thing you want to do is ensure that you select the correct thematic area. There are multiple thematic areas that you can choose from. And as you can see, care transition, you see this page here, it has everything on it regarding the basic definition of what that care, thematic area is all about. It also has whether or not you want to customize or use default, etc. If I select a different one, let's say we choose emergency care, you will see that this has changed, right? The definition has changed here. And then maybe some of the thematic area options have also changed depending on, again, which thematic area you want to move forward with. So for the purposes of this demonstration, let's just do a care transition. We're going to want to name the CTI name. So let's go forward with some sort of a care trans. Let's say we want to do a test. I'm going to just call it test. Congestive heart failure. How about that? All right, so we're going to just do a test right now. But in order for this to actually generate a CTI, we need to save it here. Otherwise, it's not going to generate a CTI if we move forward. And we know that it has because we now see this CTI ID here. Okay. Many of the CTIs will ask you if you want to include an index event. So basically what that means is whether or not the hospitalization is included the entire inpatient stay or just when the event first happened. If you select to exclude it, what will happen is essentially the CTI will start the very next day after the event occurred. If you select to include it, then you will include the entire stay, and that's all included in the cost. The trigger event, this will change also dependent upon which thematic area that you choose. Right now, because we have care transitions, it's automatically defaulted to IP discharge. But if you were to choose like an ER visit or ED visit, or an ED thematic area, sorry, you would have the option to choose specific trigger events for this CTI. Okay. Again, this little section over here on the right will basically give you the definition of the care transition thematic area. And then here, as you can see, most of them are set to custom, except for the episode length, which is set for default, which we do for 90 days. If you choose to change any one of these, so if you wanted to say the geographic service area, I'll just use whatever is defaulted, the zip codes that are defaulted in here, then you would set yes to default. What that does is it will take the tab off of the next page and it will just use the defaults that are currently being used right now. Same thing for episode length, right? If let's say you wanted a longer episode length because this particular CTI requires a longer episode, then you would come down here and you would say, no, let's customize it, okay? So I'm just going to choose customize for all of them. I'm going to hit save, and then I'm going to go next. All right. So you have the option to select the baseline period for the CTI is created. You hit this drop down here and you can choose either one of these two. That's the only thing that's available for you. We're going to select this. You're going to want to choose the participants drop down button, and you're going to want to select the particular hospital or hospitals that you are associating with this CTI. Okay, so you can have multiples. Just for the sake of this, I'm going to just select this one. Okay, now here's what Krista was talking about. We now have allowed the option for you to include those that have died or passed away during the event, or you can exclude them. It's defaulted to exclude, but if you so choose, like if you want to include those who have died during the event, then you would select the include button. I'm going to select exclude. Okay. The last thing here to review is the hierarchy precedence. So if basically there's a default hierarchy that's already associated with CTIs, and you can leave it at default by leaving it as nothing here, or you can come in and you can select your hierarchy, how you so choose. Last year, you had to basically wait and kind of go through all your CTIs at the end. Here, you can actually view your hierarchies here that you currently have available. So if, let's say, the CTI that you are currently creating should be a 1, then you know that this is going to change as well. So that's a nice little feature for you all. Down here in the CTI description, essentially we want you to be as informative as possible. We like to use this to help with best practices and basically to kind of help track things as far as that's concerned. So try to be sure that you are as descriptive as possible. Yep, spelling is a thing for me. Sorry. I'm just going to put this in here. Again, make sure that you are as informative or descriptive as possible that you can be for this. We're going to hit save, and we're going to either hit the next button, or you can just drop down using the tabs here. So I'm gonna go through one of these. The geography, the DRG, and the ICD-10 codes, they're all basically, it's the same layout, same format, same system involved. You will need to download a submission template. You want to make sure that you use the submission template because just uploading an Excel file is probably going to cause errors if it's not laid out exactly the way it's supposed to be. So you download the submission template here, and then you would add whatever zip codes that you want to be included into this category, into the CTI. Once you have done that, you can also add more than just the few that show up here. You can add other lines, and it will just continue to add down. Make sure you save it. And then when you're ready, you come to the upload zip code. You would drop in, sorry, you need to go to the file. So you need to choose the file. You would drop in the zip code template right there. And then, oh, I sent an empty one. That's why. Okay, so then you would drop in the template right there. Again, let's try this one more time. There we go. And now you will get a success tab. See, if you don't do it right, you're not going to get anywhere. You'll get a success tab here that says file uploaded successfully. And you'll see the zip codes that you have added. Now, let's say you look at this zip code list and you think, oh, this isn't the right zip code. This is the wrong number, and I need to edit that. You can double click this and you can just edit it right here. Hit save, zip save successfully, and now you have changed the zip code here. Let's say you want to, like there's a list more of zip codes that you want to add. You don't want to have to retype the whole list over, or you've lost the file. You can just add those existing extra zip codes to another downloaded file and then upload the zip code here. What that does is it'll still keep these existing zip codes and add the ones that you want to add. If you do a new zip code list, it'll overwrite everything that you've already got in there. Okay. And then you can also this is where you would manually add and delete. So let's say you decided, oh wow, this is not the zip code sequence that I want for these CTIs. You can simply hit the trash can button right here. Are you sure you want to remove the zip code? Yes. And it has now removed that zip code. Let's say you only have one or two zip codes you want to add, you can just hit the add new button and add in a different zip code. Hit save. And now it's in there. Very simple. Okay. Again, as I said, that is the exact same for the DRG and the ICD-10s. It's all, make sure you use the downloaded submission template, and it's the exact same situation for all of these. Okay. Now moving forward into chronic conditions. So this one and the prior utilization tab, these are pre-templated, meaning you'll need to go in and add something. You can choose to include or exclude based off of your chronic conditions. You can select certain conditions to exclude. You can hone in on a specific population by including certain conditions. You can select more than one chronic condition. Then you can choose whether or not to have a threshold. I'll walk through this in just a moment. If you have no threshold, each condition you choose will require you to have all of those conditions. So if you have like 3 conditions chosen, all of those conditions will be included in the CTI. Otherwise, you'll have to select the threshold. Let me walk through this for you real quick. Okay. Let's say we want to exclude any patients who may have had cancer, right? We don't want these patients to be showing up. Did I get all of them? There we go. All right, so we would just choose those, and then we could also put in a threshold that we would want them to have at least one cancer event. If that's the case, they will be automatically excluded. If we wanted to include, which for this situation we would, right? Let's say we want to include any kind of hypertensive patient, or let's see, for CHF, let's say ischemic heart disease. We're gonna include those. Now, if I leave my threshold at 1, what that means is at least one of these conditions will include those patients. I can raise it up to include both, or I could just leave it at none and it would include both. I hope I was very clear on that. I'm not sure if that came across as clear as I wanted it to. But essentially, in a nutshell, you can work to exclude any of these chronic conditions or include any of these chronic conditions, and then select the threshold of how many chronic conditions you want included or excluded. See what happens when you don't save. Hit save. Okay. I thought I had that at 1. All right, so now we're saving. We're going to move on to the next, which is prior utilization. So looking at both inpatient and ED utilization prior to the CTI or prior to the event. The intention here is to focus in on the beneficiaries who have used multiple services, or you have resources that are dedicated with connecting them with outpatient services. So for prior utilization, you will want to select the type of utilization that you are actually looking for. For example, let's choose, you can choose any one of these. Okay, so let's choose inpatient admit. We're going to want to select this. Okay, we're going to want to select our threshold, at least 1, within the past however many days. Do we want it 120 days? Do we want it 150 days, 180 days? That's what we want to make sure that we have, so we know you have a period of time that you're working with here. Okay, just remember that the more specific you get, the more your eligibility will likely decrease. The other thing that you can look at is the hospitalization in specific settings. So you can, again, include or exclude any one of these: skilled nursing facility, home health agency. And again, you can select the term date of when, what to exclude. So let's say we want to exclude the skilled nursing facility, and we want that to be done within 120 days. Okay, and we would hit save, and then the next button. So moving forward to look forward. This essentially is looking at the first setting after the index event. So by default, we are including every type of setting here. But you can exclude beneficiaries whose first settings were an inpatient post-acute care or a SNF, etc. Again, you would exclude by hitting the drop-down button, and then you would hit save. Now, episode length, again, remember at the very first page, this is defaulted to 90 days. If you want to change that out and make it a different length of time, you would deselect and you would select it to be custom. Then it will open up this tab for you. If you don't select custom for that, this tab will not show up, okay? This will give you the option to change out your days. If it is a 30-day episode length, 60, 150, like you can choose whatever your length of stay is. Save and move to the next. The model estimator, this is essentially where you go to get the information on what did my definitions or my input spit out? What is it going to look like? with the CTI created exactly the way I created it. So when you generate this episode estimate, when you're pretty much done with it, you will see the total estimated beneficiaries in the baseline and the total estimated patients in the baseline. When you generate the episode estimator, it will take a bit of time. It can take anywhere from a few minutes to a few days to get this back. Something that I know that we had an issue with last year, at least I was told, please don't wait until the last day or two to generate episode estimates, because you will likely not get those estimates until after the enrollment period has closed. So I just want to encourage everyone to be really diligent in getting in here as early as possible to create your CTIs and generate this episode estimate, because I don't want you to not get the estimate and then be stuck with a CTI that maybe you might not necessarily be completely happy with. Okay, getting back to what I was talking about. So you want to you generate the episode estimate, and you use this if you want to like compare your information, perhaps make changes to the CTI, maybe change out the baseline. Like that's what you would use this model estimator for. Also, don't forget about the another thing to note here is the output baseline volume. You'll be able to get a sense of where your MSR, excuse me, is for your hospital. And as I talked about earlier, the stop loss values, it is a very simple, quick button. It'll show you exactly where your stop loss volumes will be within the quintile that you'll be within. Once you've done all of that and you feel very comfortable with the CTI that you have built, you can hit the submit button. What this does is that it will send us a notification that it was submitted, and it will move this to the view submitted CTI button on field on the home page. You can always still, as long as the application portal is open, go back in and edit it, but it does also then allow us time to go in and do validation for that specific CTI. You also are able to, if you click this button, you will be able to download a PDF version of your submission. Okay, so let's go back to, I'm gonna hit save and continue later. Okay, so if we hit submit and we go in here to this view my CTI submissions, you would then see there is a CTI in here, but this isn't the one you were working on because I did not hit submit. But once you hit submit, you will then see it show up here. You can open it up and take a look at it, go through it that way, or you can withdraw your submission from here. And by viewing it, you can also go in and edit. No, you can't edit it from here. You have to go, sorry, that's wrong. You would have to go into edit active CT submission, find it here, and then edit it from there. Okay? Now, some of these steps may be a little different based upon whatever thematic area that you choose. Some of the options may not be available, but each one may have slightly different customizations for you, but it's essentially the same. If you have any questions, any issues, or you need assistance in doing this, again, please do not hesitate to reach out and to our, Chris care redesign, care.redesign@chrishealth.org. Goodness. And we'll be happy to jump on a call with you if that's necessary, or help you out in any way, shape, or form that we can from there. I'm going to stop for just a minute. I'm going to see if there's any questions available. Does anyone have any questions, concerns, thoughts, whether it be through the changes that we've made or anything that I've gone through on the CTP? You can also unmute yourself if you'd like. I don't see anything in the chat. So I'm hoping that we delivered an excellent webinar for you all and you don't have any questions. Let me give it another minute or two. Okay. In the interest of time, then, I can give you guys back 20 minutes to your day. Thank you very much for joining us for this webinar. Again, if you have any questions, here's the email address. We will be sending out the recording and the slide decks to you all as soon as it's up and running and available to do so. And please don't forget to reach out to go to our CTI Learning System website as well. There's a wealth of information there for you. And again, I'm looking forward to a very successful program year 5. Okay, thanks so much, everybody. You all have a great rest of your day.